Coping with COVID. Updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC. Healthy people, healthy communities. In it together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
Happy Thursday. I'm Tre Tailor, and thank you so much for joining Coping with Tre Tailor. Today, we're coping with clinical trials and the importance of minorities being involved. Dr. Marvella Ford with MUSC joins us to give us the breakdown about clinical trials, what she's doing, and why it is important. Dr. Ford, thank you so much for joining us today.
Thank you for having me here today. It's an honor.
Absolutely. She's going to come up. We're going to talk to her and so much more coming up on Coping with Tre Tailor. But first, your community updates. The South Carolina State University has officially made their interim president the 13th leader of the college after spending 9 months as the interim president since July of last year, after the previous president was ousted. The Richland County Sheriff Department has partnered with the newly opened Recreation Center. They are going to house their gang enforcement center there in Richland County. The building will also house the county's disaster relief plan. The facility, located at 140 Diamond Lane in Columbia, and is geared towards helping at-risk youth ages 5 and up, and features 3 indoor and outdoor basketball courts, indoor turf, soccer facilities and football fields, weight training rooms, and arcade games. And if you drive a Ford SUV, listen up. The company is recalling many of their Ford Explorers. As a matter of fact, 250,000 20 to 2022 of the Explorers and hybrids in the United States, because they can roll, win, and park. Owners will be notified by mail starting in June, and no crashes or injuries have been reported. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing in and around South Carolina. Visit scdheck.gov for more information. Now, throughout the show, you'll see scrolling at the bottom of the screen information on so many things that we are going to share with you, including the 5 free rapid tests that are available from covidtest.gov. Also, COVID vaccines at Lexington Medical Center. Vets will be going to the VA to get their COVID vaccines and testing. Kroger pharmacies are among the many retailers that are offering COVID vaccines. Check the screen for details about that. Also, Walgreens is offering COVID vaccines and free N95 masks, along with Walgreens and CVS, including the CVS in Target stores. Also, the Brooklyn Baptist Church has their vaccine clinic that is continuing to be open 7 days a week. And don't miss your shot. You can get your vaccine at the Comet bus station located in Columbia at the corner of Sumter and Laurel Streets, but you can also get a free ride on the Comet to get your COVID vaccine. You'll also see information about online registration help and several financial resources, including FEMA's COVID funeral reimbursement, the Lexington County Bill Assistance Program. Also, Dominion Energy and SC Housing has a collaboration to help folks that need assistance with their bills. Now, we also will give you information about SC Hopes. If you or someone you know is having some challenges coping with COVID, SC Hopes is a 24-hour assistance line from the Department of Mental Health. We'll also give you information on job listings, including Spectrum, and the City of Columbia. And also, I told you about this earlier in the week. Regional Medical Center in Orangeburg is offering a 50% discount on unpaid bills. You can call 803-809-3883 or 800-905-7561. All of that information and more will be scrolling at the bottom of the screen throughout the show. You're watching Coping with Tre Tailor. We are streaming live on the Tailor Made production page on Facebook. Please go over there, hit like and share and follow. Not only will you receive information about the show, you get notifications as to when we go live, which is Wednesday with Wellness Wednesday from SCDHEC, Department of Diabetes Action Council and In It Together SC, but you'll also receive notifications as to when we go live on Thursday and Friday at 2 p.m. Eastern Standard Time. We're also streaming live on the YouTube channel. Please go over there and hit the subscribe button. We would love for you to join us on the YouTube channel. I want to say thank you to all of you YouTubers that are joining us right now and every day. And also, please, again, don't forget to hit the subscribe button. We also have a presence on Instagram and also on Twitter. I'm Tre Tailor. You are watching Coping with Tre Tailor. And coming up, we are going to talk with Dr. Marvella Ford. She's at MUSC, and she is going to talk to us not only about her cancer research, but also about the importance of diversity in clinical trials. That and more coming up next on Coping with Tre Tailor. We'll be right back.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
Comet's always going to be there and just gets me everywhere I need to go.
We try to ride every single day. Comet is our livelihood.
Computers, they're a part of our everyday life, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall, 803-351-5821. 803-351-5821.
Hi, I'm Kimberly Aiken-Cochran. As Miss America, I know that taking care of yourself is important. Part of taking care of your health is knowing if you're at risk of type 2 diabetes. Prediabetes is serious and puts you at risk for developing type 2 diabetes. 90% of South Carolinians who have it don't know they have it. Visit inittogethersc.org. Take an online test to find out your risk and join a diabetes prevention program. Brought to you by the Diabetes Action Council of South Carolina.
I'm Tre Tailor. Thank you so much for joining us for Coping with Tre Tailor. Don't forget, we are streaming live on the Tailor Made production page on Facebook. Please go over there, hit like and share and follow. Get all of your COVID and just coping related updates and so much information and resources on that page. Also, we are streaming live on the YouTube channel. Been doing the show since March of 2020. Gosh, I can't believe it's been 2 years. And we've got so much content on there, all of our interviews and so much more. So please go over there and don't forget to hit the subscribe button. We also have a presence on Instagram and also on Twitter. Today we are talking about clinical trials, and Dr. Marvella Ford joins us. She is at MUSC. As a matter of fact, she's a professor in the Department of Public Health Sciences at the Medical University of South Carolina, where she is the Associate Director of Population Sciences and Cancer Disparities at MUSC Hollings Cancer Center. It's the state's only National Cancer Institute designated cancer center. Dr. Ford conducts research on the recruitment and retention of diverse populations in cancer research. Dr. Ford, thank you so much for joining us today. We appreciate you and all the work that you're doing with cancer research.
Thank you. It's truly an honor to be here with you today and with everyone who's watching and listening.
Thank you so much. Want to remind everyone that the comments are open. If you do have a question or comment, please post it and we'll be sure to get it to our guest today. Dr. Ford, tell me about your work with cancer research.
Yes. So I started back in the early 1990s in cancer research, and my first project focused on recruiting African American men to the prostate, lung, colorectal, and ovarian cancer screening trial. That trial was funded by the National Cancer Institute, and my work was also funded by the Centers for Disease Control and Prevention. I was really happy that those two entities recognized that it was very important to include Black men in these projects, because if we're talking about, this is a trial to test whether screening for these cancers saves lives, it's really important to have Black men at the table. And so early on, that was the focus of my career, and it's been the focus ever since.
Well, I want to get back to that in a minute, because I definitely want to know. I mean, you said you were surprised or pleasantly surprised that they wanted to include African American men, but I do want to ask in just a minute, why were you surprised? Do they not usually include, a diverse selection? But let's find out first, have there been any new developments or treatments in cancer of late? I'm sure since you've been researching, it has been. I mean, it's, over 20, 30 years, but what about in the most recent and most recently?
Absolutely. So first of all, we have lung cancer screening. So it's very exciting that now we have a method to screen for lung cancer for early detection. We always say early detection saves lives, but that's really only true for cancers for which we have a screening method. Mm-hmm. And so we know we have a screening method for breast cancer, which is mammography or a mammogram. We know we have a screening method for prostate cancer, which is a prostate-specific antigen test and digital rectal exam. We have screening test for colorectal cancer, a colonoscopy or a FIT kit, a kit. And now we have lung cancer screening. So that is very exciting, especially for communities of color, which are disproportionately targeted by the tobacco companies. You see a lot of billboards in our communities advertising tobacco products. You have a lot of convenience stores in our communities that sell these tobacco products, and they sell loosies. So, they really try to cater to the economic needs of the communities, but it's harmful to the community. And so now we have lung cancer screening. So that is something that now is available for people who, especially if they meet the Medicare eligibility requirements for lung cancer screening, that will cover the cost of screening for the people who are Medicare eligible.
That's so interesting you mentioned that, Dr. Ford, because I was just listening to a story this morning on NPR about how the tobacco companies were routinely targeting African American communities with the menthol.
Absolutely. And the problem with menthol is that it allows the harmful cancer-causing components of the cigarette to go deeper into the lungs.
Oh,
so
wow.
The menthol kind of opens up the airways, and
as menthol does. Yeah.
Menthol does it. We use it like if you have a sore throat or you're congested and you suck on a mint that has menthol, you feel your nasal passages opening up. Well, if you smoke a cigarette that has menthol in it, that menthol opens up the airways, but then it allows the carcinogens or the cancer-causing components of the cigarette to go more deeply into the tissues of the lungs. And our lung tissues were never developed to be exposed to tobacco, to smoking. That's not how we were designed, and it really is harmful to the tissue. And so having these mentholated cigarettes and targeting Black and brown communities for them has been a long-standing point of controversy in activists for health equity.
Yeah, Dr. Marvella Ford joins us. She is Associate Director of Population Sciences and Cancer Disparities at MUSC Hollings Cancer Center. She joins us today on Coping to talk a little bit. She's been telling us about her cancer research. I want to ask, though, Dr. Ford, to go back to what you had mentioned earlier about the fact that you were pleasantly and surprisingly surprised that African American males were included in much of the prostate cancer research. And is that because, well, I'll ask just why is that? Why were you surprised that African American men were included? Shouldn't everybody be included in research?
Yes. So what I was thankful for was that they funded me to do research projects, and they gave a substantial amount of funding for these projects to really make sure that Black men were included in these studies, and that also that Black men were retained in the studies. And so the reason is that when you look at cancer disparities nationally, and especially in South Carolina, here in our state, those disparities are really driven by Black men. So when you look at almost any type of cancer, and if you look at cancers overall, the group that has the highest cancer death rate is Black men.
Wow.
And so when we talk about disparities, it's really important to reach out to Black men. And I think by funding the studies, the National Cancer Institute and the Centers for Disease Control and Prevention, we're saying we recognize the importance of Black men. We need to include Black men in these studies to make sure that these screening procedures work as well in Black men as they do in other population groups, because we definitely want to improve health outcomes for all people. And the only way we can do that is to make sure that we have representatives from all racial and ethnic groups from the community in these clinical trials.
And that's basically your I guess your mantra, so to speak, or what your target is, your cause is for really working on recruitment, because as you say, to get and I'm just saying in layman's terms, to get a good idea of how treatment reacts in different people, you have to have different people involved in the trials.
Absolutely. There are lots of studies that go on, and there are lots of published articles. And when you pick the articles up, there's something called the discussion section at the end of the article. And it basically says, our sample was 98% white. Unfortunately, we don't know how well this treatment or this procedure or this social support strategy, how well it will work in other population groups. Future studies should do more to recruit these different populations into their studies. I've been reading that for 30 years, almost 30 years now. So, but I think more and more attention is being paid to this issue. And it's imperative that we as a community also participate in the trials. We can ask our doctors, is there a clinical trial? Is there something that I can participate in? Because that will help other people. Sometimes it helps us when we participate in trials. Quite often, it will help our children and our grandchildren. And I often hear people reference the Tuskegee syphilis study.
Right.
And they say, well,
and I was going to mention that.
Yes. And they say, well, that happened, and so we shouldn't participate in trials. And it's really the opposite. Back in the mid-1990s, I had an opportunity to go to what was then Tuskegee Institute. And I was invited because I had the trials to recruit and retain Black men in these cancer screening trials to speak at the meeting, but lots of other people spoke as well. And we met for 3 days. And on the third day, Mr. Fred Gray, who was the attorney for the men who participated in the Tuskegee trial, and by the way, the men were there. We got to meet them.
Oh, wow.
The survivors, they were there for the 3 days as well. But they asked Mr. Gray to speak on their behalf, their attorney. And he stood up and he said, the men asked me to speak. And he said, we've been sitting here for 3 days, listening to speaker after speaker get up and say how few people of color are participating in these clinical trials. And he said, quite frankly, the men are appalled. They cannot believe that people of color are not participating in these trials. Excuse me. And he said the men are proud that because of what they went through, we now have multiple safeguards in place that will prevent a Tuskegee from ever happening again.
Yeah.
We have what are called data and safety monitoring committees. Every investigator has to send their data. That data get reviewed. We have the informed consent process, where people have to have certain things about the trial explained to them, and they have to sign a form giving their consent to participate. All these safeguards are in place now that did not exist. And Mr. Gray said, the men have asked me to tell you that they want people of color to participate in these trials, because otherwise we're going to get left out and left behind from all these medical advances.
Yeah, it's so interesting that people use the Tuskegee experiment as a reason why they shouldn't. But the people who were involved in the Tuskegee experiment are saying that's the reason why you should.
Exactly.
That's the reason why you should. We're talking to Dr. Marvella Ford. She's at MUSC Cancer Center. We're talking today about clinical trials and the need for diversity. So, okay, so we know that, just like we said, a lot of the problem is people not feeling safe. So, who or what is needed? Is there a specific need? Or is it just everyone, kids, Black, white, Hispanic, men, boys, girls?
We need everyone to participate in trials, but, these diseases that are being studied in the clinical trials and the different types of cancer disproportionately impact communities of color. I love your work and I applaud your work with COVID-19. I mean, you're doing such great work in getting the word out about getting vaccinated. That's so important because we know that our communities were devastated.
Yes.
We had, all of us have lost people, I'm sure, to COVID. I've lost at least two family members to COVID-19 before the vaccine was available. So these things are real, and it's the same with cancer clinical trials. Cancer is real in our communities, and it's really important for us to participate in this cutting edge research, especially now. I don't know if people have heard of precision medicine and all these new techniques, but if we are not at the table, it will not be known how well these approaches to treating cancer work in our communities. And so many of us are getting diagnosed with cancer. We should be the first ones to the table saying, include us because we're suffering, put us in that we want it, we want access. We always say we want access. We should be demanding access to these clinical trials.
So, Dr. Ford, let me ask you this. And for you as a physician, of course, you probably say, of course, but for lay people, I guess it's hard to wrap people's head around the fact that there is really a difference. I mean, look, we can say we talk alike, we talk differently, we dress differently, we think differently. That's one thing. And that's what we will say as those of us who are of an ethnic background. But I think when it comes down to it, I think somewhere in our psyche, we think we're all the same inside. So speak to why it's important or how we are so much different. Our biological makeup is so much different, which is, why our specific demographic needs to be involved in the testing because we are different biologically.
That is a great question. I am not a physician. I'm a PhD researcher. So I just wanted to put that point out. I cannot dispense medical advice.
Right.
But absolutely. So we know that human beings are there, that there's more similarity between racial groups than there is within racial groups. That's a given fact. We also know that there's no known disease that is what we call like race-based.
Right.
However, there are differences, or there may be differences in how certain medications are used by the body. Are they used faster? Are they used slower? Do you want to give the same dosage to people from different racial groups? There are those differences that could affect treatment outcomes. It's the same with men and women. Years ago, 90% of the people on trials were white men. And so the dosages were based on what a white man could tolerate.
Right.
Think about Tylenol. If white men were the only ones who participated in the trials testing Tylenol, then everybody's going to get that dosage. But maybe women need a lower dosage. Maybe we don't metabolize these medications as quickly as men. So maybe we need a lower dosage for women. There are all kinds of questions like that. So it is really important, because when you're the patient who's getting ready to be given that prescription, I think we all want to say, well, were people like me included in the
Right. Is it safe for me too?
Yes, and safety, it's probably going to be safe, but we want to maximize effectiveness, right?
Right.
When
Exactly.
we take medication. If you give me a medication, if you're my physician, I want it to do what it's supposed to do. I
Right.
don't want to get a dose that is half of what I should be getting. I want to get the amount that I need to be getting. So in order to find that out, we need to be participating in those trials. I often hold up a bottle of Tylenol when I'm talking, and I ask people, do you need a prescription for Tylenol? And people say no. And I say, where can you get Tylenol? And they'll say, the drugstore, the grocery store. And then I'll say, well, the only reason we can do that is because other people in the past participated in clinical trials. Tylenol had to be tested first. It wasn't always on the market. It didn't always exist, and it wasn't always available without a prescription.
Wow. Wow. Dr. Marvella Ford joins us. She's a professor in the Department of Public Health Sciences at the Medical University of South Carolina. And she also conducts research on the recruitment and retention of diverse populations in cancer research. Dr. Ford, what happens during a clinical trial? Let people know what they can expect.
That's a great question, because we've been talking a lot about medication, but a clinical trial might be testing whether having a support person with you when you go to treatment produces better outcomes. It could be a phone-based intervention where what's being tested is having someone call you on the phone to see how you're doing once a day, to check in with you, to see whether that improves outcomes. So a trial can be a trial of a medication, it can be a trial of a therapy, it can be trial of a new machine or technique, and it can be a behavioral trial testing social support and whether having support makes a difference. It can test physical activity. My colleagues and I ran a very small study with breast cancer survivors, and we actually worked and they with our cardiac rehab group, and the women went to cardiac rehab and they exercised, and what we found is that really reduced their levels of biological inflammation or bioinflammation, which is linked to a cancer diagnosis and to cancer recurrence once people are diagnosed. So it can be as simple as a physical activity or exercise intervention. And yes, we practice what we preach, so we were exercising too. We have to all do the same thing, right?
Yeah. So this would be, so all clinical trials, every clinical trial is different. So that type of clinical trial may be a good entry level point, so to speak, for someone who, may be a little hesitant about digging deep into a medical or another type of clinical trial.
That is entirely possible. At the same time, if someone has been diagnosed with cancer and there's a trial available, they might have a different perspective on the urgency of participating in a trial. Because in a trial, the minimum that anyone would ever get is the current gold standard of care.
Mm-hmm.
So people sometimes have a misperception that, I can't go in a trial because I take medication for diabetes or hypertension and my doctor would not want me to stop the medication. And we say, we wouldn't want you to stop the medication either. You should keep taking it. The minimum that you will get in a trial is the current gold standard of care. That current gold standard of care is going to be tested against something new.
Right.
We don't know whether the new, whatever it is, new treatment, new therapy, new social support, whether that will produce better outcomes or the same outcomes as the current gold standard or worse outcomes. That's why it's being tested. But at minimum, if someone is in a control group or a usual care group, they will get whatever is the best current care available.
Yeah.
That's required. That's by law.
Dr. Marvella Ford joins us. We've been talking about her research on the recruitment and retention of diverse populations in cancer research. We've only got a couple of minutes left, Dr. Ford, but I want to ask you before you leave, can people receive compensation and how do people find out about clinical trials?
Yes, absolutely. So they can go to clinicaltrials.gov, which has the clinical trials all over the country. If you want to call me, my number is 843-876-2433, and I would be happy to link you with the clinical trials at the MUSC Hollings Cancer Center. I did want to talk about a great project that we have right now.
Sure.
It's not a clinical trial, but it's called the SCA Men Study, and it focuses on providing prostate cancer education and navigation to screening for Black men. We start each session by telling the men how important they are to their families, their communities, to the state, and to us. And in that project, there's a 1-hour prostate cancer education session. Then we navigate the men for 3 months to prostate cancer screening, because right now in South Carolina, the prostate cancer death rate is about 2.5 times higher for Black men than for white men.
Wow.
Each man will get a minimum of $100 for that 3 months of participation, with the chance to have an additional $100 as well. So minimum $100, maximum $200.
And who is it for? It's from African American men. What age?
Yes, ma'am. Thank you. It's for African American men ages 40 to 69 years, and we will go where you are. So what we do is we partner. So if anyone's interested in getting a group of at least 10 men together, we can meet virtually, or we can travel wherever the men are in the state for just the 1-hour session, and then everything else is done by phone.
Awesome. Awesome. One more thing about that particular study. Do the men need to be in any particular health? Do they have had to have had prostate cancer at one point, diabetes, heart disease, whatever, just Black men?
Black men who have not had prostate cancer.
Who have not had prostate cancer.
Yes, ma'am. Thank you. Yes. They can have diabetes, heart disease, but because it's for prostate cancer screening,
right,
they cannot have already had prostate cancer. Screening means getting checked for cancer before a doctor has ever told you that you had cancer.
All right. So for more information about trials, or this particular clinical trial that Dr. Ford just mentioned for African American men, where you can be compensated financially, and they can come to you wherever you are. You can see her email address and website and phone number, I think, is on there also on the screen. So please contact. And if you want information about clinical trials in general, if you have a question or have a comment or have a concern or want to know where a good, safe clinical trial is, please contact Dr. Marvella Ford. Dr. Ford, thank you so much for this wealth of information. I really appreciate you coming on today and sharing. Thank you so much.
Thank you so much.
All right. Awesome. Listen, if you have a story or initiative that could help someone cope with COVID, please email booking@copingwithtretailor.com. Booking@copingwithtretailor.com. That information is scrolling at the bottom of the screen. If you have a product or service that could help someone cope with COVID, please email copingwithtretailor@gmail.com. We would love for you to be a proud sponsor, just like In It Together SC and the Diabetes Advisory Council. They sponsor Wellness Wednesday every Wednesday here on Coping with COVID. Also, we're sponsored by Computers Unique, Dutch Square Mall, the Fifth Circuit Solicitor's Office, Attorney Byron Gibson. No Justice, No Peace comes on every second Thursday. We're also sponsored by the Comet Bus System, Javis Tax Service, and also Agape Counseling and Training Services. Now, coming up next week, we are going to start a series about gardening, your own fruits and vegetables in your own backyard. If you're interested, we are going to do the first Wednesday of every month, beginning next month, May through September. And we're going to go right there. So go ahead and get your pots and your seeds and your all of that and come join us every first Wednesday, May through September. We're also going to do some taste testing of vegan foods and so much more. We're really excited about this Wellness Wednesday initiative. Plus, we're going to have next month a conversation about Mother's Day and about losing a mother. We're going to bring together some people to talk about how it feels and how they've dealt with losing a mother. Also, the electric buses are in at Richland School District 1 in Columbia, South Carolina. We're going to go on an electric bus and tell you all about it. And also, May is Teachers Appreciation Month, and we're going to talk about some teachers who have impacted lives throughout the city and state. All that and so much more coming up next month on Coping with COVID and Coping with Tre Tailor. As usual, I leave you with a devotional reading. And of course, we've been reading from, where's my book? It is Conversations with God. It's from Cheryl Mims Williams with Agape Counseling and Training Services. I love this book because it is a series of some of her journal writings and also scriptural readings. This one, I just opened it and it says, Father, you are more than enough. I'm nothing without you. I can do nothing without you. Let me keep my hand in your hand. I pray for clarity and confirmation on what you will have me to do. Let your anointing fall fresh on me this day. That's a beautiful prayer to say every morning. God, I can't do it. Please help me do everything because I need you today. That's what is this? Conversations with God from Cheryl Mims Williams with Agape Counseling and Training Services. I'm Tre Tailor. Thank you again so much for joining us today and this week on Coping with COVID and Coping with Tre Tailor. Until the next time, we wish you peace, abundant blessings. Take care. God bless. And don't forget to wear your mask. That's right. I'm a masker over your nose and under your chin. We'll see you again next week. Take care.
Coping, find peace of mind to survive through whatever. Coping, learning the way that we thrive all together. Coping, finding out what's real. Coping, we can heal, we can heal, we can heal, we can heal. Coping with strength, coping with strife, bringing hope for success in improving our life. Coping beyond hoping to do more than survive, ways to live a healthy life. Coping and promoting, learning what you can do. 6 days to a better you. Coping, find peace of mind to survive through whatever. Coping. Coping, find peace of mind to survive through whatever. Coping, learning the way that we thrive all together. Coping, finding out what's real. Coping, we can heal, we can heal, we can heal, we can heal. Coping with strength, coping with strife, bringing hope for success in improving our life. Coping beyond hoping to do more than survive, ways to live a healthy life. Coping and promoting, learning what you can do. 6 days to a better you. Coping, find peace of mind to survive through whatever. Coping.